Good morning, everyone, and welcome to the Biz Essentials podcast. I'm your host, Veronika, and today we're going to be speaking with Allison. Allison is going to be teaching us all about integrative manual therapy. Now, if you've never heard of this before, don't worry, because I hadn't either. But let me tell you, once you hear her story, you're definitely going to want to know more. Integrative manual therapy is not a magic bullet, but it treats the whole person, mind, body, and spirit, and helps the body heal itself. Allison can explain it better than I can, so stick around and listen to her story. Seriously, it sounds like a healing miracle, and it's perfect just in time for Christmas. I'll be back with Allison right after this.
Tony Robbins once said, "No matter how many mistakes you make or how slow you progress, you are still way ahead of everyone who isn't trying." This is the Biz Essentials. You want to grow, get ahead, keep the spark. Here you'll get valuable insights and empowerment to grow personally and professionally. Isn't it about time you turn your dreams into successful passion projects? Learn how to be productive, be successful, be joyful, and more importantly, be yourself. The B Essentials. This is the Biz Essentials. And this is your host, Veronika of Veronika Ventures.
Welcome back, everybody. Allison, I'm so excited that you're here. I know a little bit about your story and what you do, but why don't you share that with our audience?
Yeah, definitely. So I grew up in California. I was a competitive gymnast. I did pole vaulting. We did soccer, like lots of different sports. And I had some really bad falls on my neck. And then when I was 16, I began to have all these symptoms of fatigue and some neurologic problems started. And I began to fall a lot. And so what they think happened is I had some damage in my upper spine and my neck from all the falls. And then a virus just got in my spinal cord and kind of had its way with me, just really damaged a lot of my nervous system and was causing havoc in the covering around the nerves and then also organ damage. So I had a lot of complicating factors and I was having like seizures and I became fully quadriplegic, meaning I could move from the neck down. So that was a pretty quick turnaround from going to like a 3-sport person to not being able to brush my own teeth or turn the TV channel or go to the bathroom by myself. It was a real kicker for me as a 16-year-old to be like, I need help going to the bathroom. So doctors didn't really know what was going on. And all they could really do was hand me a basket full of pain medication, which I was having ridiculous responses to, and then be like, well, good luck, and I did go to an inpatient rehab facility where I was doing physical therapy and occupational therapy to help me get back on my feet again. And that did help a little bit, but it didn't solve the underlying damage to my nervous system. So we then started looking to more alternative health options. And we found something about a year later called Integrative Manual Therapy. And that was a big turning point for us because up until that point, we hadn't heard like, oh, we think we can help you. And so that was a moment where we got some hope back. And that was incredible. That was an incredible feeling.
What do you guys think of her story? Isn't it incredible? In just a moment, I'll be back with Allison, and she's going to teach us all about integrative manual therapy, how it helps people with all aspects of life, including things like chronic illnesses like fibromyalgia or MS, back pain, anxiety, depression, autism spectrum disorder, and even trauma. You're not going to want to miss the rest of this interview, but before we get back to Allison, I want to thank all of you who have signed up for our email list. Be sure to check your inboxes for more details about that exclusive content I've been telling you about. And if you haven't had a chance to sign up yet, be sure to go to thebizessentials.com and sign up today. The link will be in the show notes, but you're not going to want to miss this content. Anyway, guys, let's get back to Allison because I can't wait for you guys to hear the rest of this episode.
From there, we just were doing a bunch of the alternative treatments and I was getting better and better and better. And as anyone who's struggled with anything health related knows, it is never a straight line. You never are like, okay, I'm improving steadily from point A to point Z, but it's an up and down process. And that up and down process took me, off and on between 10 and 20 years, different aspects of it. So I began to become really interested in alternative health, researching for myself, and I became an alternative healthcare practitioner. I started with doing the integrative manual therapy. There's a 3-year postgraduate program that I went through with them. And then I was like a voracious consumer of all things body related because I wanted to get better for myself. I wanted to be there for my family. And I began to, have different patients that I was also advocating for. And it just was a really wonderful, long, painful, awesome journey of being motivated by my own pain, but also those around me. And then I worked at different clinics for a while. And then me and one of my colleagues opened up our own clinic, and we ended up even competing on American Ninja Warrior, that obstacle course TV show where people are very fit and strong. So I really did make quite a transformation from going to not being able to turn the channel or brush my teeth to being able to compete at a pretty high level. That was really fun to do. But a lot of times people would be like, you should write a book. Your story's so incredible. The motivating factor for me to open my own practice and begin to help other people was really COVID was a turning point for me. So everything was shutting down, and it made me so upset that people couldn't access their care. And I had been kind of feeling the nudge to speak or teach or connect the dots for people and in a bigger way, in a more impactful way. And it just infuriated me that people were at home needing the tools that I had. And I was like, I have to get these tools to them so they can feel better. And the time is now. So that really became the turning point for me when I began to serve a bigger audience and have an online platform so that people could learn and heal and just become hopeful and empowered for themselves. I'm so shy, Veronika. I really am quite an introvert, and I love teaching people. I love helping them, but like speaking on a summit or being in front of an audience was always like, gulp.
Wow, what a story. So you went from a total athlete, which I never was, but a really big athlete, to not being able to move, back to eventually a really good athlete again, because people who are on the podcast can't see you, but you're gesturing with your hands, and you've been on American Ninja Warrior, so clearly not paralyzed from the neck down anymore. There's so many questions that I have. I can't even imagine what it would be like to be 16 and going through that, first of all. So wow, congratulations. That takes a lot of strength. I'm not going to pretend or ask or delve into how difficult that must have been. I commend you though, because clearly here you are and you're using that as a way to help people. And that's super important and super impactful. And thank you for sharing your story with us. Where I want to start though is where you started to really get better, which was through this therapy, this alternative medicine. Can you tell us a little bit about what that is and how it works?
Integrative Manual Therapy is a bouquet of lots of different alternative therapies. So there's a little bit of cranial sacral, there's a little bit of acupressure related. There's quite a few osteopathic techniques from osteopathy. And now in the US, if you go to a DO, a doctor of osteopathy, they're basically the same as going to an MD. But in the olden times, before it kind of became one big Western medical conglomerate, they used manual therapy, used different techniques to help people pump their lymph differently or release their organs. So there's a lot of hands-on work with the body that integrative manual therapy does to shift not only like the environment around the organs or the nervous system, but the actual anatomy of the shape of what's happening there. So there's a lot of nuances. And the woman who developed it, her name is Sharon Giammatteo, and she's since passed away, but she worked with me a lot directly and created a whole protocol to help me get better. And then when I was learning, I got to train with her directly, which was really, really fun. And she created this international network of different clinics that people could go to. And this also community-based way of taking care of people's wellness on multiple different levels: social, spiritual, emotional, mental, physical. And they used to have what's called intensives, they would call them. So you would go into this big room and there'd be a ton of tables set up. And we're so entrained now to be like medical privacy is the utmost, and you go in and no one sees you. She felt like people got better faster when you could see like, hey, that older person who came in with a cane like isn't using a cane anymore, or that child who was having a hard time maintaining their cool, basically, their nervous system was feeling a bit frazzled, or they were autistic, maybe they're doing way better. So not only do you see people's suffering, which A lot of times when we're in that space of trauma or pain in any aspect, we feel really alone and isolated. So there was a really cool way that she brought community and just included that in how people healed and got better.
That's amazing. So let me recap a little bit to make sure I'm understanding correctly. The therapy itself, it sounds kind of like you're manipulating your body during different pressure points. And I'm sure there's a lot more intricacies to this, but basically doing that to facilitate the healing within your body.
Yes.
Perfect. I absolutely love, first of all, the integrative part of it, where you're combining your physical self, spiritual self, and your, I don't know, mental self sounds wrong, but you know what I'm saying? Your brain, body, and spirit, because we are whole people. And a lot of times, especially in Western societies, that's not always focused on. And I think it is a huge impact on how well we heal, as well as the community aspect. That's awesome, because you don't hear about that, especially here in the US. You're right. They even have like side exits so that people don't see you coming in and out. But a lot of the times when you are in that tough spot, it does feel very alone. And that's why I love the podcast, first of all, because I feel like we get to talk about everything and open up. And for me, COVID was a huge game changer too. I would have never done this. Total introvert. I can be like this with like really close friends and or with alcohol. That's pretty much it. But here I get to connect with people I've never met before on a totally deep level, and I love it. One thing that you touched on briefly was a child with autism. So does this help with behavioral things and things that we wouldn't necessarily consider a medical issue?
Oh, yeah. So there's a lot of things that aren't labeled as like a physical problem, but they have a lot of physical components. So a child with autism, or an adult with autism for that matter, there's a lot of different things that are happening with their nervous system. A lot of times there's food sensitivities or sensory deficiencies that are happening. Another modality that I've done and use a lot is called Z Health, and they have a neurologic approach to wellness and rehab and performance. And they talk about how your brain gets information from 3 different places: your visual system, which is your eyes, your vestibular system, which is like your inner ear, and your proprioceptive system, which is like if we feel the clothes on our body or the chair that we're sitting in or the car that we're driving, that sense of space and how we connect with our environment. And a lot of times with autism, those are not synced up. So the brain is feeling threatened because there's like a skip on the record. It's not getting all the information at the same time, and it's not congruent. So when we have that happen for us, a lot of times it'll result in feeling grumpy or feeling like I need to go to a safe place, like don't talk to me, or, you feel really stressed easily. So we all have that on varying levels. And for a nervous system of someone who's autistic, it can look very much more heightened in that regard. They feel easily threatened. Their brain is always asking, not just their brain, our brain is always asking, like, am I safe, or should I run? Is there a tiger? Should I be in fight, flight, or freeze? Or should I be in the other gear of the nervous system, which is like rest, digest, and heal? So when we have these aspects of our nervous system that are out of balance, we can change the way they sync up by doing different treatments or doing different drills, doing different exercises to help the body become more congruent and balanced.
That makes a lot of sense. I hadn't considered it, but yeah, there is a lot of, especially sensory things. I have 2 children who are on the spectrum, so that's why it piqued my interest, because I was like, interesting. Now they're super high functioning, but the sensory thing, total issue. Food and clothing, God forbid, it's scratchy.
Heck no, to get those tags away. And, there's like a huge digestive aspect. When we developed, our GI tube and our neural tube are the ones that connect and begin initially. So there's like a lot of relationship between GI health and neuro health. So anything neuro also has a gut component. Anything gut also has a neuro component. A lot of kids with sensory processing disorder or autism, there's also a slew of food allergies or selective eating, or there's all these different layers in there as well. So doing different treatments or doing different exercises, drills, etc., can really change the way that the gut is interpreting their environment, how they're taking in food, how they're able to assimilate, absorb, and eliminate what they don't want.
That's really super interesting. Like, I just want to like sit here and talk to you all day about this, because when you're talking, I'm like, oh yeah, that makes sense. It's totally clicking, but I would have never put it that way or thought of it that way. So that's great that that knowledge is out there somewhere and you're here sharing it with us. I want to go back to your story because that really intrigued me. Obviously, I've been 16 before. I would have not handled this well. How old were you when you started doing the integrative manual therapy? Like, how much space was there between you're paraplegic and now you're finally getting hope?
A year. And I also had some other complicating factors where I couldn't be in a regular wheelchair, because I couldn't sit up. So they have these wheelchairs that recline. And so I had to be back because I couldn't hold up my own head. So when I started going to them, I was in one of those reclining wheelchairs and I had a problem. Now it's called POTS, where you have a problem regulating your blood pressure. And so if anyone sat me up, even though I couldn't sit myself up, if someone actually moved me in a more upright position, I would lose consciousness. I was 17. It was really weird because, initially the doctors didn't know what in the heck was going on. I was definitely declining more and more, and they didn't know if I was even going to live. And so it was my junior year of high school when this was all happening. And in the spring, we still had no real answers. And I was totally depressed and did not want to live like that. And like you said, you wouldn't have handled it well. I didn't handle it that well. I mean, initially I was like, I have no coping skills. Every stress relief thing that I knew how to do was physical, go for a run or do a workout. That was how I dealt with my emotions. So I got a real opportunity to develop some new skills quickly. But I didn't have a lot of guidance in that regard either. So I did listen to a lot of music, and that was helpful for me. It was like the time of Discmans and where you could like order a bunch of CDs for $1, those kinds of clubs.
Columbia House.
Yeah, exactly.
I'm pretty sure I still owe them money.
So I did a lot of that, and music became a big way that I was internalizing support and help, and my family was really wonderful. But my friends didn't know how to meet me there. And my nervous system was freaking out so much, if they came to visit me, I could have, 3 seizures in the time that they were there. It was a hard pill to swallow to be a friend of mine at that time. And, they were picking out prom dresses and looking at colleges. And I was like, I don't know if I'll be here next year. So it was a really tough time mentally and emotionally. And I definitely cried myself to sleep most nights because it was really hard. The other side of that is it was pretty amazing to get better. Like I would be like, oh my gosh, I sat up today during lunch. Like I couldn't believe that I was able to sit up and hold myself up and eat. And sometimes there'd be other conversations going on, which would be very taxing for me. And like when I was able to make those milestones, it was pretty incredible. And I still, Veronika, I have to be honest, I still like love going to the bathroom by myself. I love brushing my teeth by myself. When I go into a public restroom, I don't have to use the handicap stall. Sometimes I do just because I don't have to, but it's not like I have more choices. I have 3 kids. I have a husband. I have my own practice. I have 2 dogs, 2 cats. There's a lot of things in my life now that I never would have had back then. So I do appreciate it. It's given me a certain perspective per se that you don't normally get.
Yeah, I can imagine because it totally turned your life upside down and backwards. And then to have that growth, it's kind of like when you were talking about, I hold my head up. I was thinking, when you see your baby or your kid for the first time do those things, it's so exciting. So I can imagine what it would be like when you haven't been able to do those things. And then to be like, yes, progress, we're getting there. How long did it take between you're starting to get better and now, I don't know if you're 100%, but you look 100% and it sounds like you're competing at a pretty high level. So how long did that process take for you?
From when I started the integrative manual therapy and the reclining wheelchair and not being able to sit up without passing out to walking without a cane, that was really quick. That was 5 months, because once they were able to resource my body and help to address the underlying damage that the virus had caused, I really improved quickly. So that part was really wonderful. But my fatigue and my sensitivities and I call it bank account body, where, we have a certain balance that we have to maintain. And for one person, going to the store might be like a $1 withdrawal. And for somebody else, it might be $100 withdrawal. And you can't keep going on in your life day by day if you continuously overdraw. So that was a really hard thing for me to learn, was like, if I overdo it one day, then I'm kind of like in bed for a week. And so I was really wonderfully functional. I could walk to the bathroom, but I couldn't do my laundry and take a shower in a day. So learning how to balance and letting my body heal, because I was using so much energy to heal. I didn't have a lot to spend on parties, or even watching TV could be too much. It was an interesting time where I was like, I'm moving, but I'm not participating in life necessarily. And the Ninja Warrior was, I was just looking this up the other day because I couldn't remember. I think it was 2013, 2014. I had 2 kids at the time, and it was really fun. They film at night, so it's kind of inconvenient for the athlete, but fun for the filming. So we had the kids with us, and my sister-in-law came with us, and the kids wanted to see our runs. And so we would wake them up and bring them onto the course when it was our turn to run at 3 a.m.
Wow.
I was on the second obstacle, and I heard, "Mommy, mommy." So I think she was 4 at that time. And she had started this chant, and the whole audience had just like grabbed onto it and was chanting, "Mommy, mommy." And that was really fun. And I was laughing so hard I fell off the obstacle, but it was worth it. It was a really fun memory.
How cute. Oh my gosh, I can't even imagine. I have my own little cheerleader. I play softball, and my 6-year-old is out there going, "Go Valley Hitters." Man, that's our team name. It's adorable.
So cute.
But wow, I can't fathom what that would be like. The one thing that came to mind when we were talking, and we touched on it a little bit with the autism, there are traumas that are more emotional, neurological traumas. Let's say like what they call it, ACEs, the adverse childhood.
Yeah.
Those have physical effects on our body. Can it work backwards? Can you use this type of therapy to work through that body system to help heal the neurological emotional trauma?
Absolutely. Yeah. Absolutely. We are mind, body, spirit, but there's not different boxes for those. We are all contained in one being here. And the body is incredible, where I don't know if you've ever heard of The Body Keeps the Score, or Dr. Emoto did that whole study on snowflakes or water and how intention changes the water at a molecular level. And so he would do these really cool studies on how if you have water from like really polluted dam and you put an intention of love on the bottle and you freeze it and you look at the molecular structure, it changes from this distorted, discolored water structure to beautiful and pristine and lovely. And you can conversely take like high, pure mountain lake, untouched by the spoils of man, and put war or hate or something like that on it, and it'll distort the molecular structure. So it works both ways. And we are a huge percentage of water. So you just think about that and how that contributes to how we talk to ourselves, how we interact with the world. It's kind of like a little bit mind-blowing to think about that. It absolutely works both ways. I mean, think about a time when you were really stressed. You were maybe really emotional about something terrible or horrible or something that violated your belief system. If you marinate in that for a while, you begin to have physical symptoms. Or sometimes you have physical symptoms and that's like, I must be really stressed. You're like walking around with your shoulders by your ears and you're really tight. You maybe have some stomach issues, or the way that we manifest physically and emotionally are tied. Absolutely.
Interesting. I need to investigate this only because my listeners know I have childhood trauma. So I clearly, this might be something that will be helpful. And I'm super interested in it because I think that there's a lot of people who would put those things in separate boxes. In fact, if you ask my therapist when we first started, totally different boxes. They were not allowed to commingle. Still spend a lot of time in my head. But that's really interesting that you can work that way to heal yourself in a way that I would have never considered using towards something that is, for most people, entirely neurological or at least mental. Some people wouldn't even believe that it's neurological. And that's a whole new thing that just came out in the 90s with the ACEs study of how it really does impact your brain and make structural difference to your brain. So Now that we've been talking about healing in the nervous system and everything, how would you say that that would help people through their business lives or?
Yeah. Well, I mean, how does your brain relate to business?
Good
It's hard to
point.
separate. It's like, how do you feel in your body? How do you show up for yourself, for your business, for your clients? It matters. It really matters. So I love to teach people how to monitor their own nervous system and try and find some tools and nuances that are quick and easy to do that help bring you back into balance. So there's 2 gears of the nervous system. There's the parasympathetic, which is the rest, digest, and heal. And there's the sympathetic nervous system, which is the fight, flight, and freeze gear of the nervous system. So if you think of that as the 2 gears that we operate in, when you have a brain that is stuck in sympathetic, that fight, flight, or freeze, that's changing how the brain is signaling to your body what hormones to release, how much insulin to release when you eat, how much sweat should be pouring from your armpits when you have a big interview. So if you can have these tools to regulate your own nervous system, you are going to be able to connect to yourself better. You're going to be able to do business and come from your heart instead of be totally disassociated and stressed. And I think that people respond to that, right? When you meet someone who's really present and really can listen instead of being so distracted by their own physical, mental, emotional outputs, it puts you at ease. It makes you feel different. You want to do business with that person when they can meet you and they can hold a safe place for you. So if you have a nervous system that's out of balance, it's harder to do that. You might be able to fake it for a little bit, but in the long term, it's shallow. There's no roots that can take hold in there. So for people in the business world, being able to do a quick reset for your nervous system before you walk into a meeting, before you meet with a client, before you make a big decision. If you can make a decision out of a balanced place versus a stressed place, it might be a different decision. So I love teaching people some little tools for that. So one of the big nerves in the body is called the vagus nerve. It's the 10th cranial nerve, and it comes out of the back of the head, and it goes down your neck and wraps around your heart and goes down into your digestive system. And that nerve is really tied to a lot of parasympathetic activity, the rest, digest, and heal. And when we are stressed, we can't rest, digest, or heal. And that would be a lot of people's problems, right? They can't absorb, they can't sleep, they can't eliminate. Stimulating that nerve usually goes really well for people. So if you guys want to try it really quick, I'm just going to talk to you guys about how to test in your own body if this is an appropriate drill for you. So if you just take a little range of motion, if you just turn your head from side to side and see how your neck feels, like how tight it feels. And then we're going to do a drill that helps to stimulate the vagus nerve. So the vagus nerve, again, is important in helping balance our nervous system and bringing you into that more parasympathetic state. And so one of the ways that we can do that is by gargling. So Veronika, if you want to do it with me, we can just take a little sip of water and gargle.
Okay.
So you can do it like for 10 seconds, maybe repeat it 3 times.
Mm-hmm.
But for just us, and if you've tried it along with us, just recheck your neck range of motion and see how your body feels after that. Does it feel looser? Does it feel relaxed? Yeah.
Yeah, totally.
Nice. So when our nervous system reacts immediately when we give it an input, and we just gave it an input that said, hey, maybe you should relax a little bit. So I feel like a little bigger sense of the chair that I'm sitting in. I feel like I'm a little more connected to my body, and my range of motion isn't improving because my brain is feeling more balanced and safe. If we're about to step onto a threatening surface, like if you were about to step onto a pond, unless you're an A+ ice skater, it's probably a little bit threatening. Your movements would be stiffer. You'd be walking in a different way. You would be like shuffling, and you wouldn't be doing twirls probably because you could slip and fall. That is a real threat. So your brain is saying, hey, don't move very much. This is, I'm not so sure about the surface. So you think about that and how that impacts your flexibility and your ability to move. Conversely, if you put an input where you're telling your brain, hey, you're okay, we're good, we can just relax and rest. It'll open up your range of motion. You'll feel more movement. So when we just tested our neck range of motion there, we got the information from our body that it was moving better after we did that drill. And our bodies liked having that rest, digest, and heal spectrum brought into our nervous system.
Interesting. I think that would be really useful for me because I totally do that. And I can feel my body react. And it's so funny because I never realized what it was until I started working with a therapist. And I'm like, oh, that's why that happens. Because I always run really hot. Even after having lost like 170 pounds, I would run really hot. But until I realized that when it's like a trigger response, like my body temperature physically goes up and I turn red and it's ridiculous and I hate it. But knowing that, like obviously awareness is the first step. Now it sounds like this could be pretty impactful. I can absolutely agree with you that being connected with yourself will help you in business because you do show up more authentically and can make those connections. So yeah, it makes my question seem kind of silly, but whatever.
No, I think it's important to make those connections because whether or not you're recovering from a chronic illness, an injury, or you're just trying to land your next best client, like these drills and exercises are relevant, especially post-COVID. There's so much threat and stress, like pandemic, changing the way that we interact with people, not being able to see their faces. Like there's a lot of threatening information that's in our environment now more than ever. And so being able to come back to center, come back to ourselves, get ourselves in balance. And, what's good for me might not be good for you, but how are we going to know if we don't try? So it's a wonderful way to be able to monitor your own self and be able to do something about it. You don't have to wait to go to the doctor's office and get a prescription. You can be like, okay, I'm feeling stressed. I'm going to do something right now about it. Or I know I'm going to be stressed, so I'm going to do something right now to get more balance before I go into that meeting or that
podcast interview, one of
podcast interview. Yeah, exactly. Right. So you can do some things preventatively, you can do them in the moment, and it helps you balance, it helps you heal, it helps you become more connected to yourself and to your family, your loved ones, your business.
Right. And I would imagine, like you said, you had kids. I can imagine teaching this to my children and setting them off on a better path through their lives than we were.
Absolutely. My oldest son has ADHD and a lot of executive functioning opportunities to grow, we'll say. And my second one is my daughter, and she has sensory processing disorder. And my third one also has a little sensory processing disorder. We do a lot of these things in our life to help them feel more comfortable in their bodies, to be able to make better connections in their own brains, but also with other people, because they're not so triggered or disassociated, and they can, have better friends or sit in a lecture for longer before they spin out of control. We've been homeschooling since COVID, and I've been doing these drills on myself quite a lot because homeschooling, I'm a reluctant homeschooler, to be honest. I said I'd never do it.
Me too. And I did it last year. It was totally stressful. But go ahead. I'm sorry.
As you know, it's pretty stressful to keep calm, trying to be the parent and the teacher and do your business. So these drills are no joke. They come in handy a lot of the time.
Absolutely. And you mentioned to me that you were in Colorado. So do you work with clients just locally, or do you work with them virtually as well?
Well, I developed a group program called Inner Restoration, and it is all about teaching you how to heal yourself. So I go through all of these different wonderful tools that can help you become the best version of yourself, and to be able to really let go of some traumas, some things that are maybe in your system, whether that's mental, emotional, physical. And people with chronic diseases, illnesses, or even ACEs are able to then know how to better monitor themselves and be able to do something about it. So I worked with a lot of people who have diagnoses like Lyme disease or chronic fatigue or joint pain or MS or anything, something like that.
Fibromyalgia.
Fibromyalgia, yeah, absolutely. So if you have a brain and a body, like the program is designed for you. You are trying to change your baseline, and with being able to monitor yourself and input different information for your brain to balance itself, you can change the physical, emotional, mental, social, spiritual symptoms that you're having. For one person, that might be depression. For somebody else, it might be ankle pain or muscle tension or anxiety. It's been so fun to work with more people and make more of an impact. And I love hearing, the stories. I mentioned earlier in the interview that the brain gets its information from 3 different sources, mainly the visual system, the vestibular system, and the proprioceptive system. And so the visual system, the eyes, you can do different eye drills to help bring a clear amount of safety and calm into your nervous system. I've had a couple people who get migraines, and a lot of times they're triggered by light, and they'll be shopping in Costco or something, and they'll feel it start to come on, and they'll just pull the cart over, do a little eye drill, and then be fine and be able to finish and come home and not be in bed for 3 days. So that's been so fun. I love hearing stories of success like that when people can monitor themselves, make something happen right away. They don't have to wait till they get home to take a medication. They don't have to wait to go to a doctor. They don't have to wait to go to a chiropractor, an acupuncturist, or whoever is part of your team. They can make those changes in the moment.
Wow, that's so empowering too, because sometimes when you have those things come up for you, at least for me, it seems like you feel so out of control of your body and what it's doing. So being able to have those tools, I can imagine, would be very empowering. At least it would be for me.
Yeah, it's all about agency and getting your whole tool belt set up for what works for your nervous system and being able to be more in control of how you feel on all the levels. Right. While we're talking about your group program and stuff, where can people find you if they want to connect with you? Yeah, I have a website that people can go to. I have a free Facebook group that people can come and join on in. For those of you who want to connect with Allison, go to her website at inner-restoration.com. You can also join her free Facebook group called Inner Restoration. In that group, she focuses on a topic and does live trainings weekly. She also has a free 5-day training called Wellness Jumpstart, and the next one starts in January. So I will be sure to put those links in the show notes as well. The Wellness Jumpstart. I'm going to write that down so I don't forget to sign up for it, because clearly I have issues. As we all do. That's true. Before we wrap up, is there anything that we may have missed that you want to touch on for our audience? I don't know how many people have something that's chronic, whether that's anxiety or knee pain or nausea, MS, it could be anything. But what I would love to tell people is that your body's worth fighting for and that there's hope. There's always hope. That's amazing. I think a lot more people have chronic pain than they would like to admit. Just in my general poll of my brain of people who I speak with, like everyone always seems like, oh, my back is out again, or, Yes, it is shocking to me what is quote unquote normal for people to experience on a daily basis. Like, wait, what do you mean? It's not normal to feel like I'm going to throw up every time I eat. It's not normal to only poop once every 2 weeks. It's not normal to, have raging anxiety the entire day and not be able to sleep for hours and hours. That's not normal. That's what I've experienced my entire life. Are you saying that's not normal? I'm just kidding. I know what. Newsflash. I feel like this whole conversation, you're like in my head, I don't sleep. But Allison, this was such a fascinating and fun conversation. I want to thank you so much for your time. I learned a ton, and I know our listeners did too. It was absolutely my pleasure. I loved talking with you, Veronika. Thanks for having me on. Absolutely. And guys, I want to thank you so much for listening. If you enjoyed today's episode, please share it with a friend. And of course, it would be great if you could write a review. I would truly appreciate it. Anyway, guys, I'll be back to wrap up the show right after this. Wow. Reflecting on Allison's interview, I can't imagine what it would have been like to be 17 and going through all of that. I truly admire her honesty on how difficult it was. Sometimes when we're going through the struggles, we can feel very alone. Sharing that pain and the triumphs that come with it can really be helpful to other people. It's stories like hers that reaffirms my belief that everyone has a purpose. I don't believe that everything happens for a reason, especially things that are considered bad things. Bad things don't happen for a purpose, but you can make purpose out of the things that happen to you. Speaking of purpose, I truly want to help all of you find your purpose and give you the tools to help you turn that purpose and that passion into that life that you've always wanted. I say this in my intro, but I really do want you to be productive, be successful, be joyful, and more importantly, be yourself. 2022 is going to be our year. So go to theBizEssentials.com and sign up for our email list. Join the movement and make 2022 your best year yet. Anyway, guys, thank you so much for joining me today. I hope you had a Merry Christmas, Happy Holidays, and I'll see you next time on The Biz Essentials. Bye.
You've been listening to the Biz Essentials. Thanks for listening to the show. We hope you've gotten some useful and practical information, learning how to be productive, be successful, be joyful, and more importantly, be yourself, and turning your dreams into successful passion projects. By listening to this show, you've already set into motion the most important part, starting. So it's important to catch the next episode. Make sure to like, rate, and review the show. In the meantime, hook up with us on social media at Veronika Ventures and at the Biz Essentials. Till next time, this is the Biz Essentials.
Today's quote of the day is, movement can replace many drugs, but no drug can replace movement. Author unknown. Thanks again for being here with me today, and I'll catch you next time. Bye.